How do you know if your patient has shoulder impingement? Well, open your Clinical Pattern Recognition Orthopedics app from PhysioU. Go to the shoulder region. Note the patient's pain pattern. Commonly, the patient reports a sharp pinching pain in the subacromial region. A couple of hypotheses show up here: subacromial pain syndrome and acromioclavicular joint sprain. Of course, the history is typically different between the two. Subacromial pain syndrome will often have a history of overhead use of the shoulder. In the physical exam, under key findings, you'll notice a cluster called impingement assessment. Here you'll note the arc of pain, the Neers test, Hawkins-Kennedy test, and rotator cuff manual resistive test. You'll note that in the test item cluster, a positive Hawkins-Kennedy, a presence of a painful arc, painful or weak external rotation resistance test, the presence of all three give you a positive likelihood ratio of 10.56, which is good for ruling in subacromial pain syndrome.
Take the patient's arm into flexion, horizontal abduction, stabilize the top of the shoulder, and internally rotate the humerus, looking for available range and reproduction of symptoms. Compare it to the other side. A positive test is limited range or pain in the shoulder.
Develop your clinical reasoning with the PhysioU apps at www.physiou.com.